Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
We're here in South Beach, and this symposium that we're part of today is on BHRT, but we have something new that I don't think anybody else has, which is a new state of mind, which is psychedelic medicine. And, you know, everybody's using it, everybody's trying it. It's kind of the domain of psychiatrists, anesthesiologists, and we have the pleasure and the honor of having Dr. Scott Fisher, who happens to be a leader in the area, and he's a psychiatrist, of course. And he started out as a basketball player in high school, and I got it because he's about 6'10", you have to see. But anyway, you started out in psychiatry, and so tell us about how you got interested in it, and tell us more about it, because I think it's fascinating, and you all think so too.
Yeah, so I am a psychiatrist still, and I'm also the lead facilitator and clinical program manager at our Center for Psychedelic Research at Siegel Trials. Our center is located in Fort Lauderdale, so just up the road from here in Miami Beach. And Siegel Trials has been doing clinical trial work. They're a clinical trial site mostly. We have a network of sites here in South Florida. They've been doing it for 20 plus years. Our Center for Psychedelic Research opened in about 2020. So my background as a psychiatrist is I did operate a private practice here in South Florida for over 8 years. And while I did see a fair share of, successes and strengths of, the commonly used things in psychiatry practice nowadays in terms of medications, psychotherapies, etc., I also felt like there were a lot of limitations with those. Many people not getting full responses, a lot of treatment resistance, a lot of side effects to the medication. There also was an emerging body of research showing that, say, things like SSRI or selective serotonin reuptake inhibitor antidepressants weren't nearly as effective as they initially had seemed from kind of industry-supported research, and that on average, they weren't necessarily a whole lot better than placebo. So that kind of my personal experience practicing psychiatry, combined with this sort of emerging research showing, relatively ineffective kind of levels of treatment with, antidepressants at least, I became interested in, okay, what else could there be?
Right.
So psychedelic research also started to pick up kind of in the mid-2010s. There were a couple of big studies in 2016 that showed a lot of promise. So that combined with some of my own personal experiences with psychedelics, which were very kind of transformative and important parts of my life, led me to do a certificate in psychedelic therapy and research at the California Institute of Integral Studies. I did that in 2018. It's an accredited institution, but also kind of a hippie place. But it was a really important program for me to do. I got very well networked in that program and eventually got hired by Siegel to help with their psychedelic studies because of that training that I'd done and my expertise with the psychedelics. So there's kind of a variety of clinical experience, my review of kind of the research and also my personal experience that led me to kind of shift now. And now I work full-time in clinical trials for psychedelics.
So that's really interesting, because psychedelics, as we know, we started in the 60s, I guess, and 70s. They were very popular, and then they took a nosedive for reasons that I'm sure you can tell us.
Yeah, I'd be happy to
tell
explain.
us about that.
Yeah, so they're, they did become very kind of popular, used in kind of the general culture, in the US especially in the 60s. But there also was a lot of research done with particularly LSD, but some of the other psychedelics. There were over 40,000 human research subjects dosed with LSD or other psychedelics in the 50s and 60s. Over 1,000 published research studies. It was a very promising area of research at the time. They were looking at things like alcoholism, anxiety, adjustment problems with like life-threatening illnesses. But because there was also just kind of strong like kind of recreational use by the general public, so to speak, the Controlled Substance Act was passed by the Richard Nixon administration in 1970, which not only outlawed the use of psychedelics for the general public, but really shut down the research. So from about 1970 through at some point in the 90s, there were actually no psychedelic studies done in human research subjects. It actually was a couple of nonprofits in particular that helped kind of open up that area because there wasn't going to be any grant funding money. Pharmaceutical companies didn't want to touch the stuff. So it was really nonprofits and charitable donations that helped create the funding to kind of open psychedelic research back up. And now there are a lot of for-profit companies. Now there are kind of government-funded studies happening as well. But it took a long time for that to happen.
Right, because it seemed like a huge gap. And when you picked it up and where you are, what do you find and what do you work with the most?
Yeah, so our center so far has focused on studies of what we would call classical psychedelics. So the first study we worked on was the study of psilocybin, which occurs naturally in a variety of mushrooms. Mm-hmm. So magic mushrooms are something a lot of people have heard of, psilocybin-containing mushrooms. So our first study was the study of psilocybin for the treatment of major depressive disorder. It was funded by a nonprofit called USONA Institute based out of Wisconsin. And we were we're really proud of being one of the top dosing sites in that study. We also were working with other clinical trial sites around the country, like at Johns Hopkins, NYU, other kind of major academic institutions. We're a private site, but they were also involved in that study. And it showed, pretty strong placebo effect because these are double-blind, placebo-controlled studies. So pretty strong placebo effect in those studies, which a lot of mental health studies will find strong placebo effects, but even a very much stronger psilocybin effect. And what's really important to know, I think, about most of the psychedelic research being done is we use something called set and setting protocols. So we're not just giving them, the drug and, sending them home.
I hope not.
We're not just giving them, say, small doses, like the
microdosing kind of
microdosing, or like if someone takes Prozac or Zoloft, they're taking a daily dose that isn't necessarily they're feeling from day to day, but only over time might they feel something. So we do preparation sessions. We usually have 2 very highly trained licensed therapists, one of which is myself, and I have a few colleagues that I also work with on this research. And so we do usually at least 4 to 5 hours, sometimes up to 8 hours of preparation sessions with the therapist, where one of the really primary elements of the preparation sessions are forming a therapeutic rapport and a comfort level, because we know this person may be undergoing a very highly altered state of consciousness. So we want them to be really comfortable with the people that they're in the room with. We dose them at our center. We have very private dosing rooms. It feels like a living room. It doesn't feel like a clinic or a hospital. We offer them eye shades so they can have an introspective journey during their psychedelic dosing, because we do think that what is experienced subjectively during your psychedelic session could be highly correlated or mediating a positive outcome, and may also be correlated with safety factors in the study, which is a topic I could definitely delve a lot more into in terms of what are some of the subjective effects that kind of are of interest to us. So one thing that so afterwards we will give them questionnaires and say, okay, how much was your experience, fall in line, different sort of rating scales. So one that we give is called the Mystical Experience Questionnaire. Mystical experience, sometimes also people think of it as like a spiritual type of experience or religious type of experience. There's kind of different words used. But if people score high in the Mystical Experience Questionnaire, they will agree with things like transcendence of time and space. They felt themselves outside of normal time or outside of normal space. There was no space, or they were within infinite space. There was no time, or they felt the eternity of time. They will feel a sense of unity, like they feel one with all creation, or they recognize that all of the universe is somehow unified through some central mediating mechanism. Intense positive emotions of awe and joy and peace can be experienced. What we call a noetic quality. They feel like something about ultimate reality is being transmitted. that can be really hard to put into words. Ineffability is a big part of the mystical experience. People will come back and say, I really can try and describe this experience in words, but there's no way I'll come even close to describing kind of what that experience would mean. So that's kind of how mystical experience is defined, and we've shown in a lot of the studies that if people have high degrees of mystical experience in their psychedelic dosings, then there's a much higher likelihood that they also achieve a positive outcome for like treatment of depression, treatment of substance use disorders, things along those lines.
How long are the sessions?
So it
The
depends.
average.
Depends on what drug we're studying
Right.
and its duration of
Right.
activity. So a lot of the studies are kind of studying just a single dose and how effective that is. We do have some studies that might have multiple doses given like weeks apart as well. But for psilocybin, for instance, that's usually a 6 to 8 hour day. We also did a study of LSD for generalized anxiety disorder. LSD is a much longer acting psychedelic, so
Right.
those are at least 12-hour dosing sessions because you don't want to send people out until
No.
they're kind of, the drug effect has
Right.
stopped and they're back to their baseline and
Right.
able to navigate, reality in an effective way.
Right. These patients, tell me who they are. You said that there are people who have experienced like severe emotional.
As part of, working in clinical trials, we focus a lot on recruiting people who are a good fit for the studies.
Okay,
So
who
all
are-
of our studies have inclusion and exclusion criteria that are meant to have at least somewhat of a homogeneous kind of population, and also to screen out people that we think it might not be safe or a good idea to give a psychedelic. So there's usually 50 or more inclusion and exclusion criteria that must be satisfied for someone to be able to enroll in one of our studies. So it's a bit too numerous to go through all of the ones in each study as different things. But common inclusion criteria would be you have to have, say, major depressive disorder of at least a moderate or severe kind of level to be able to enter into the study. You have to be in the right age range. Common exclusion criteria might be like you can't have a history of schizophrenia as well, because we don't want to have, like I said, we want a depression population. We don't want someone who's also having bipolar disorder, or we don't want someone who is, maybe medically unsafe. They just had a heart attack a few months ago, and now we're going to give them something that can increase their heart rate and their blood pressure, which psychedelics can sometimes do. So yeah, it's a very carefully screened, population in terms of who enters into the study, and it also depends on the study. The psilocybin study was for major depressive disorder. The LSD studies for generalized anxiety disorder. We have some studies now for treatment-resistant depression, which means people have tried at least 2 antidepressants and they haven't really worked for them. We have some studies that are coming for post-traumatic stress disorder, as well as postpartum depression as well.
Sounds really interesting. What are your, like you said, about age criteria? So what
It
is
depends on the
age?
study.
Yeah.
So they're adult studies, so all of them usually have to be at least 18. Some give an upper limit of 65 to 70. Others don't even have an upper age limit. We can one of our studies, they can be any age above 18 and enter into the study.
Right.
Yeah.
I think that's fascinating, and I think to me it's interesting that you have the 4 to 5 hour pre-study, so you
Yeah.
can actually get some idea who these people are.
Yeah.
Because I think a lot of people will want to do it and try it, and basically you don't know why.
Well, the preparation sessions, we really get a very detailed life history.
Yeah.
I will, tell people, well, tell me about your parents and how they met, and start from that far back. Tell me about
Good.
your ancestry.
Great.
What was your mother's pregnancy like with you? Do you know anything about that?
Interesting.
Really, really very detailed life history. The sort of kind of life history that normally wouldn't be elicited by a psychiatrist or even a psychologist in much shorter.
It should be though.
I think it really helps our work, at least, and I really get to know a lot about these people. Ask them what's their first memory, and I have them just go through their entire life story for me. That's a big part of I think the preparation is me knowing as much about them as possible. Also a chance for them to get any questions they need answered about me. We give them a lot of kind of psychoeducation about if it's a psilocybin study. Okay, here's kind of what we know about psilocybin. Here's the science so far. Here's ways we think might be kind of productive ways to move through the different states of consciousness that can happen with psilocybin. For instance, people can sometimes have negative aspects or challenging experiences of their psychedelic sessions, where they might feel anxiety or paranoia or sadness or grief, shame or guilt. A very common coping mechanism people use in real life and sometimes in psychedelic sessions is either avoidance or repression, suppression, to try to move away from painful experiences.
Right.
It's just a common kind of neurobiology of a lot of animals is to
being
avoid pain.
Right.
And so we really, we bring it up that we recognize that this is, a common way of trying to approach difficult emotions. In the psychedelic sessions, we encourage them to try not to suppress or avoid or to push away, but to allow in for the processing with the aid of the psychedelic, and that we're there to help support them should they need help with challenging experiences. Now, most of the people in our studies don't experience significant challenging experiences, probably because we do so much preparation. We're in such a safe, controlled setting.
So I was going to say to you that's what it sounds like.
Yeah,
the foundation is solid.
I think that helps a lot, but it can still happen, and we think that it might even be productive for some people to actually face some of these difficult emotions that they previously maybe were just kind of suppressed, but incompletely suppressing and coming out in other ways. So aside from mystical experience, one other thing we look at is something called emotional breakthrough, where people will say, I was finally released from emotions or trauma that I've been dealing with for months or years. I was, finally able to face emotions or situations in life that previously just were too painful to face. We've also seen in some studies, particularly in PTSD, post-traumatic stress disorder, that people, if they've had high degrees of emotional breakthrough in their dosing sessions, they're much likely to also get better from their PTSD. So that's also part of the preparation sessions, is preparing people, okay, how can we keep grounded? How can we practice mindfulness? How can we approach challenging experiences in a way where we're not just trying to run away from them, because often they'll just persist.
So how do you, let's say, you said it could be one session or it could be numerous sessions over time. How do you decide who's going to have one session and it's goodbye, we'll see you some other time? And how do you decide those who will be over time repeated?
That's a really wonderful question. And from a scientific standpoint, we're not totally sure who would benefit from a single session versus many sessions. I think what's important for me to explain is that in these clinical trials, we have very specific study protocols to follow. So this isn't necessarily where if I see someone as a clinician and we give them one dose, and I was like, okay, that was good, I'd like to give a second dose. I can't do that unless the protocol somehow allows for that to happen. Most of the protocols are very specific. Either this is a single dose study, so even if I as a clinician thought that person could probably benefit from another dose, the protocol doesn't allow it. It's a single dose study.
So what
Whereas
do you do?
some of our others, we tell them that we tell them there's a very very lengthy informed consent process, so people know ahead of time what they're signing up for. They know that a single dose is going to be offered. We talk about that with them in the preparation session. We also have integration sessions afterwards where we meet with them in the day after, the week after, and 2 weeks after usually, to talk about how was your session, this is with the therapist, and to kind of see if there's any processing that might be useful to happen. So, one part of working in these clinical trials is you kind of have to follow the protocols to a T. There's not a lot of room necessarily for creativity in terms of as a clinician. So that
you're going to get the data.
That hopefully could change once, when and if some of these become FDA approved and clinicians can, get back into some of the art of medicine. But this is really very scientifically driven.
I agree about the art of medicine, because what made me think about when you were saying it was, okay, so the patient does well, and then they're gone and they're no longer part of this, and then they can get it from someone else. And they won't know the dosing, they won't know what you did, and how do people decide, and how do they then go to another practitioner? What do they do? Because, people will do whatever they need to do to help themselves.
Yeah, I mean, we don't, so in our studies, our follow-up is, usually anywhere from 3 months to 12 months after their dosing. And we only know what they tell us.
Of course.
So we assume that there probably are some people who after, their psychedelic dosing in a clinical trial may seek psychedelics thereafter. but we don't necessarily at this point have a lot of good data on what percentage of people do that. We do know a lot of people, after they say have a strong psilocybin or LSD experience, they may have very positive effects, but it's also of such an intensity that they're not often rushing back to do it right away, because it just was like, it was a lot, know. Right. So yeah, that's something that we don't have a lot of data on. It probably does occur to some extent. And if people ask us about that as therapists, we caution them a lot about just making sure they're protecting their safety as much as possible, because that's our number one priority as therapists, to make sure they're keeping themselves safe. So are there ways to probably safely get access to some of these drugs or plants or funguses, not through a clinical trial? There probably are safe ways of doing it. Humans have been doing it for millennia without it being in a clinical trial. Right. But we don't necessarily have the data to guide people into how to do that. So, as someone who works in clinical trials, we definitely tell them to exercise caution with.
Yeah, but what you're doing is great. Mm-hmm. It's amazing, and it's actually changing the face of what psychedelics were. And I think it's amazing. I think your work is really great. Thank you so much for sharing with us all this amazing information, and good luck with the studies.
Thank you so much. I really had a pleasure speaking with you today.
It was my pleasure.
Yeah, wonderful.